on? All right. Well, good morning, everyone. Appreciate you being here this morning. It's been a little while since we've done a COVID-19 media briefing, so we got the band back together this morning. Now that we're getting back into school, I want to thank what we call the Mike and Mike show from Sanford and Avera. They're going to be here at the podium here in a few minutes to talk about what they're seeing from the hospital perspective, and I wanted to give you several updates from the city, just where we sit today in Sioux Falls as it relates to COVID-19. So I was reflecting this morning with my team members, and we talked about the fact that it was just a touch over 5 months ago that we had our first case of coronavirus. In 5 months, what has happened in our world, in our community, in our city in 5 months, it's really been unbelievable. And I'm just so proud of the way that this city has responded in those 5 months. The balance all along with coronavirus in Sioux Falls has been really twofold: protecting our economy, our way of life, and protecting people's lives, and balancing that out in hospitalization numbers. And as you'll see here, I think we've done a fairly solid job of both. At the end of May, the Sioux Falls City Council lifted any restriction we had in this market as it relates to COVID-19. We had no business restrictions, we had no gathering restrictions, really no restrictions. So we've been going almost 2.5 months in what I'd call a normal environment. And when we did that, and when the council did that, lifted those, my expectations, quite honestly, was that we would see a higher level of infection rate and higher numbers than even what we see today. So we're one of the very few states and cities that has taken this kind of restriction-free approach. But so far, it's worked in Sioux Falls. And remember, in the last 2 or 3 months, we've had presidential rally in our state. We've had the Professional Bull Riders Tour, the first major indoor ticketed sporting event since COVID started. We've had tons of softball tournaments coming to this town because they can actually play here. We have a motorcycle rally going on within our state. We have a lot of tourism happening in our state, both on this side and on the west side of the state. And so it hasn't been because of a lack of interest or a lack of things going on. But I think there's been a certain level of responsibility that people have taken here. So one thing that we continue to remain vigilant on is our numbers and our data, and tracking our data daily. And there's a handful of numbers that we watch on a real regular basis. We continue to look at the number of active cases in Minnehaha and Lincoln counties, as well as the entire MSA, which is our 4-county area. We look at the cases per capita in our county. We've been watching our percent positive rates, but probably most importantly is we're keeping an eye on those hospitalization rates. Because again, that's probably the most telling factor as we keep moving through our COVID response. Early on, the response that we took as a city was to ensure that we have healthcare capacity. That if people get sick with COVID, they would have the access to enhanced treatment should they need it. And even though, as we'll see in a minute, our positivity rate has increased the last couple weeks, our hospitalization rate has been very steady. And so that's a very good thing, good sign. So I want to just remind you that siouxfalls.org/COVID-19, you'll be able to get at the dashboard and the stats that we're going to look at here. So I want to show a couple things on the slide here. I know that's impossible to read, so we'll get this to the media after this. But what you're looking at here is the last 3 months. So this is the last 90 days. And I want to point out in the upper left, you're seeing what's happened with active cases. We're about where we were back towards the end of May in the number of active cases we are. And you can see the increase that's happened really the last 30 days. You can see what's happened then with the new daily cases. Anywhere from a low of 4, 5, or 6 to all the way up to a high of, at the end of July, we had an 84 case day in Sioux Falls. Most importantly, however, I would point at that hospitalization chart in the lower right. That's what's very important. And you see the trend line there, which is a downward trend line since the end of May. That's something we watch very closely, because of that case count. Too often I think a lot of people in the region will get a big case day, and the state will put out numbers, and my office will all start and get lit up. And they'll say, oh, here it comes, Mayor. I told you. Here's those PBR numbers we've been waiting for. Here's the Trump rally numbers we've been waiting for. And while we see those increase in cases, they're not the severity of them, and some of that's due to the ages of the people that we're seeing infections rates kind of with is younger population. And I will say that because the younger population, I'll say the 20s, 30s, they maybe have a little bit more bravado is the right term, or feeling of invincibility with the virus. And so we are seeing a higher infection rate right now in some of those younger populations. It's very important to remember, though, when you look at data like this, that we are comparing our data against no one else. Okay? We are not Miami or Houston or LA or Denver or Minneapolis. We have to continue to do what's best for Sioux Falls. We are somewhat social distanced by nature in our entire state, and we have a duty to protect the 80 square miles of this city. And so it's very easy to turn on national news and see the stories of what's going on in other communities, other counties, other municipalities. Again, I just would really encourage people not to get caught up in the media hype around coronavirus. Okay, there is the infodemic, which I call the misinformation, has been as hard to manage as the pandemic itself, and the misinformation is really a challenge, and so that's why we get it straight from the horse's mouth, our healthcare partners. What we're seeing on a local level, because that's the information I know that I trust and that you all should trust here on a local level. So one of the things that we have to continue to do, and one of the reasons I think we've been somewhat in a good position here in Sioux Falls, is because I think our residents have taken their role and their response very seriously. Our businesses have, our citizens have, through the respiratory hygiene, through the hand washing, through the social distancing, and through the mask wearing. And so I want to thank those businesses and those residents who have done their part in helping to slow the spread of this in Sioux Falls. So one of the things that continues to get brought up, not obviously just here, but nationally, is the topic of masks and mandating mask wearing. And should we have a mask mandate in Sioux Falls? And we've seen some mask dates in other municipalities, even some that are as close as Omaha, I see recently put in a mask mandate based on the data that they were seeing. I will tell you that right now, the data that we have in front of us doesn't justify or warrant a need for a mask mandate. However, does that mean that it couldn't happen in the future? Absolutely not. Very well could. And that's a card that we have in our deck of responses. So if you play all your cards right away, you don't have anything to fall back on should those numbers, hospitalizations, things like that, really increase. Then we have to start looking at what else can we do in our market. And so on the subject of masks, my response is this: wear them. If you go into a business, wear them. Respect other people by wearing them. It's an easy thing to do. My kids will be wearing them in schools. It shouldn't be controversial. It's not controversial, but also, read the situation and the comfort level of those around you as well. And there's been times when I haven't worn a mask, and I walked into a room, and I was the only one without a mask on. And I realized, all right, I need to mask up in this environment because I don't want to be the only guy not being sensitive to the rest of the people in the room. So protect your neighbor, protect yourself, wear a mask. Speaking of schools, so schools are starting today. Some of the Catholic schools are starting today already. And so we need to remember right now that the leaders in our school administrations, I believe there's 7 school districts that all have some footprint in the city of Sioux Falls. They all have a little bit different plans of what back to school looks like, but they have very difficult jobs right now. And so my ask today is that we continue to support those school leaders. That's the school board members, that's your superintendents, that's your principals, and the decisions that they're making. They have nearly impossible jobs right now. I have 3 kids, 14, 11, and 7. They go back to school on Wednesday. I have no hesitation of sending my kids back to school. Based on my school's policy, the 11 and 14-year-old will be masked up every day, all day. The 7-year-old, it will be optional, but they're going to strongly push it. If you know my 7-year-old or most 7-year-olds, get them to do anything all day is hard, so that will be up to the teachers and the educators, but I have no concerns about sending my kids back to school and keeping students in school. If we want to keep the students returning to school and we want to keep our schools open, it's going to require efforts of our entire community. So decreasing the virus transmission is up to all of us. The better we do with that, the safer the schools will be and the longer they'll be able to stay open. I would also ask that we extend some grace right now. So each of us shares, what I've learned in the past 5 months is each of us share a different perspective on this virus. What worries me is not so much the health side, but the business side. What worries this person is they don't care about business, they care about health and their mother who's compromised, and we all have a different concern or a worry right now in our community. And so the 2 key things that I've really been pushing for people are empathy and flexibility. All right? You have to be able to pivot, change. You're going to require flexibility, especially if you're a parent right now and your kid's going to be in school. There's going to be the need to be flexible because there will be an outbreak in your school. Someone will have COVID in your school. A teacher will probably have COVID at some point, and that's okay. We have a lot of people who get coronavirus, very few who end up in the hospital. So we have to be comfortable with that. We have to know that that's going to happen. I also, lastly, want to provide a couple updates on the business front. All right, so if you remember, we have an initiative called SOAR, Supporting Operations and Resilience, where we're helping businesses adapt through this unique and challenging time. And we've had more than 250 referrals. We've done close to 100 technical assessments where the city health team and inspection goes into a business, assesses the business, and says, hey, here's some things you may want to do differently and consider doing differently. That has helped keep a lot of our businesses open and operating. It hasn't been without its challenges. There's some businesses that have closed their doors, some temporarily, some permanently. But I will say our economy is strong right now. And I never thought I'd be able to stand up here and say that in August, 5 months after this hit. But we're still predicting about a 0% or about a flat revenue year for the city of Sioux Falls. And I tell you what, in this landscape, if we can finish in a flat year, it would be an absolute win. So flat is a win, and we're on schedule to, and we're pacing to have a flat revenue year. So I'm very, very pleased to report that too. So those are some of the updates that I wanted to share, some of the data that I want to share. 2 other quick slides I did want to show before I turn it over. This is one slide that I know a lot of people will watch. This is our percent positive rate. And so again, this is, you do 100 tests, you get 10 positives, that's a 10% positive rate. And so the more testing we do, if testing ramps up, sometimes that can impact the positivity rate. But you can see the last 3 or 4 weeks, we've moved into that double-digit mark. Anywhere from 10 to kind of 12% we've been hanging out a little bit. But again, I'm comfortable with that because of this low hospitalization number that we're seeing over here. That's not trending up in a corresponding fashion. So that is good. The other thing you'll find at siouxfalls.org/COVID-19 is this dashboard, which has comparable cities: Sioux City, Des Moines, Omaha, Fargo, Minneapolis. What they're seeing with their case counts. That's good because those are our peer cities within our region. There's a lot of talk about the weather responsiveness of the virus. Does it react to humid climates, southern climates, northern climates? These are all of our kind of northern, upper Midwest peers here, so that's a good resource as well to see how Sioux Falls is tracking compared to some of those other cities. So with that, I'm going to turn it over to Dr. Michael Elliott. Again, Dr. Elliott's the Chief Medical Officer at Vera McKinnon Hospital and University Health Center, and tremendous ally for us in this journey, keeps in touch with our health team regularly, and so he's going to give you an update on how things are looking at the Avera system. So, Dr. Elliott?
Good morning, everyone. Again, my name is Mike Elliott. I'm the Chief Medical Officer here at Vera McKinnon Hospital. I have some prepared remarks for you. I'll share this morning, turn it over to my counterpart at Sanford, Dr. Wilde, and then we'll be back at the end if there's any questions. I'd like to start first by thanking Mayor Tenhaken, Director Franken, all the folks that have worked behind the scenes. Avera supports the City of Sioux Falls efforts. They recently came out with a document, a Safe at Work Together document, with some core action items for physical safety, for emotional and social safety. It's a wonderful document. Really a guideline, a template for schools, for businesses, for any organization. You can look at that, you can see what you're doing, maybe what opportunities you have to improve. This isn't rocket science. This is common sense. We've heard it over and over again. It is so important, as the mayor said, to stay vigilant. I've heard some people say that maybe COVID really isn't all that bad. Maybe it's a lot of media hype. I want to share some numbers with you this morning and then let you judge for yourself. Worldwide, we are approaching 22 million cases of COVID globally and nearly 750,000 deaths. Sometimes these numbers can be overwhelming, a bit numbing, but think about that, 750,000 deaths. Each one of those deaths is an individual, and they have friends, family members, loved ones grieving right now because of the horrible consequences of COVID. This isn't fictional, this is real, and we have to take it as such. Here in the United States, 5.5 million cases and over 170,000 deaths. Compare that with what the U.S. sees for influenza, as an example. Since 2010, there have been every year somewhere between about 12,000 and about 60,000 deaths attributed to influenza each year. 12 to 60,000 versus the 170,000 U.S. deaths we've seen so far with COVID. And as we all know, those numbers continue to increase. Now here in South Dakota, unfortunately, we did cross a major milestone. We now have more than 10,000 cases in the state of South Dakota, and we're at more than 150 deaths. Again, not to be taken lightly. All of this, as the mayor pointed out, there isn't just one number that we can look at to decide what to do next. There have been many tough decisions that have been made through all of this. Decisions that have been made based on the best data we had at that time, only to find out the next day that data wasn't very good and we had to change course. I think we can all be comforted, though, that Mayor Tenhaken, that Director Franken, that the council members really do have the best interests of Sioux Falls in mind. I think we can be comforted that the school board and the school superintendents have the very best interest of students and families in mind. Comforted to know that Avera, Sanford, the Unified Command Center here in the city is working together and working diligently to make sure that we are planning for whatever this fall might bring. We aren't through this yet, so it's critically important that we all stay vigilant. Simple mitigation strategies: wear your masks, social distancing, good hand hygiene, wash the surfaces, the doorknobs around your buildings and homes. And by all means, if you have symptoms, even mild symptoms, please, for the sake of yourself and those around you, stay home, isolate, take good care of yourselves, and help decrease the risk of spread. Unfortunately, we've seen a real toll that this pandemic has put on everyone. some folks, unfortunately, have put off necessary medical treatment, and we've seen untoward consequences of that. I realize some of you may be reluctant to access a healthcare facility, that talking to people through plexiglass barriers or masks can be a little intimidating, that temperature screens and symptom screening checkpoints can be a little off-putting. I promise you those are there to ensure your safety. I will tell you right now that our hospitals, clinics, pharmacies are safe places to come and to receive care. I can confirm that we have no evidence, zero evidence, of any healthcare transmitted COVID to patients in any of our Avera facilities. We're proud of that. We are working hard to maintain that. I hope you can see that diligence as you're walking through the halls of any of our facilities. Before all of this started, Avera was fortunate. We had an incredibly strong foundation of e-care, virtual care, and we've been able to put that to good use. We've been able to provide visits virtually, monitoring of our patients in a home setting, allowed access to folks that maybe didn't have the ability to come to a clinic. And through those efforts, we have been able to keep our hospitalization rates at a low and manageable rate through all of this. I'm going to put a plug in here. You know, one of the best ways to protect yourselves this fall is to make sure you're in good general health. And one of the things you can do related to that is get your flu vaccine. This year, maybe more important than any other, critical that you get your flu vaccine. Talk to your healthcare provider, understand the risks and benefits. I will tell you, frankly, if we see an uptick in COVID numbers and at the same time we see a surge in influenza numbers, yes, our clinics, our hospitals could be overwhelmed. So take it upon yourselves to do whatever you can to stay as healthy as possible. In terms of how we're doing at Avera McKinnon, and really the entire Avera system, our COVID numbers are manageable. Our number of admissions, fortunately, has matched our number of discharges, so we've stayed very stable over the last several months. I can assure you that our supplies of personal protective equipment are very good. We do have a surplus at this point in time. We know that if we see a surge, that surplus could go away quickly, but we have been able to maintain a good supply. We've also been able to maintain a very good supply of our pharmaceuticals. So therapeutic medications for treatment of any and all types of diseases are good at this point in time. We are not having shortages there. And then finally, right now, our supply of testing kits and sample collection kits for COVID is also very good. We feel quite confident in our ability to robustly test folks that need to be tested. Finally, I got a question the other day, and I'm sure it's on all of our minds to some extent. When and how does this end? When is the pandemic over? Well, simply, it's when the numbers start to drop, right? When we see a steady decline, not just locally, but across the United States, across the globe, when we see a general downward trend back to significantly lower numbers than we're seeing today. How does that happen? Well, hopefully we develop a vaccine that can mitigate its spread. We're looking at options for other therapeutic agents that may be able to treat and or prevent. Avera has been able to stand up several clinical studies looking at experimental agents that could treat as well as prevent the symptoms of COVID. I'll give you a little teaser. Within the next week, Avera is going to release a press announcement. We're starting a really exciting 3-phase experimental treatment study. and there'll be a lot more to come on this, but I guarantee you it'll be groundbreaking. Early in this pandemic, I shared a reflection with our Unified Command Center. It was a reflection that we were sharing across the Avera footprint. It was written by an author and a speaker named Laura Kelly Finucci. Some of you may be familiar with her work. As a reminder that there's some positive hope on our future on the horizon, I thought I'd share it with all of you this morning. When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, a Friday night out, the taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, life itself. When this ends, may we find that we have become more like the people we wanted to be, we hope to be, and may we stay that way, better for each other because of the worst. With that, I want to encourage all of you to stay safe, and I will turn it over to my colleague, Dr. Wilde.
Thanks, Dr. Elliott. Thanks, Mayor Tenhaken. And I'm Dr. Mike Wilde, the Vice President Medical Officer for Sanford and Sioux Falls. And a lot's already been said, and great messages. However, we'll reiterate, I think some very important messages. And the first off is just sincere appreciation to the people of Sioux Falls, the people of this region. And I've talked about this before. Tremendous response in the setting of our need as a healthcare organization, concern over a massive influx of patients, protection of the hospital, and working very closely with the city to address that concern, realize the evolution of this, and how we can then get our community back and running. And it really took a tremendous effort from the citizens of this area, and it's going to continue to take that effort in regard to containing spread of this as we start getting back together more frequently. I will reiterate the message on infection prevention because I think it's so important. And the mayor and Dr. Elliott really made some nice points there as well. This is a large droplet that we've learned a tremendous amount about in a very short amount of time. But it is on surfaces. It is in close proximity to people as you're near people. Thus, we take measures to prevent its spread. And so just really being conscious about common touch areas like light switches, door handles, common pay areas, things like that. And if you do get in contact with some of those areas, make sure you wash your hands and do a good job with that, whether it's soap and water or the hand sanitizers that are out there. If you do wear a mask, and I agree with the points made, be a good steward of that mask. It belongs on your face or safely secured away. It does not belong on your chin or on your arm or anywhere else. Realize what the purpose of the mask is and wear it appropriately. At Sanford, we certainly see the direct effects of the COVID illness. We see those effects as shown up here. We have had a rather steady rate of hospitalizations. It does go up and down some. We've had tremendous success with a home monitoring program. So patients that are ill but do not need hospitalization, how can we keep them at home where their care is best? And have had a great success from that standpoint, and that can be, you can enroll in that program through your primary care clinician. As a large organization with multiple experts, including intensive care unit physicians, hospital-based physicians, infectious disease physicians, we collaborate on a weekly basis together across the upper Midwest, sharing best ideas, best practices, latest evidence, and what we need to do to best care for those patients with COVID. We are providing all the latest medications and support. We are participating in clinical trials and continue to do that. certainly leading the way in certain trials. Just stood one up recently in our intensive care unit looking at anti-inflammatory medications. As we look at treating COVID, there's the direct effect of COVID, and then there's a story I don't think we hear a lot about, and that's really the indirect effects of COVID. Recently, in fact, just this past week, Centers for Disease Control released information on survey they had done with patients or people as they deal with this pandemic. And literally a third of them responded that they had post-traumatic stress symptoms in response to dealing with consequences of the pandemic. That does lead to a tremendous increase in anxiety and depression. And I would say more so than COVID, we're certainly seeing the direct effects of the mental anguish that patients have. We're seeing more mental health needs, whether it's substance use, whether it's behavior issues, which certainly is a threat to our staff as they try to care for patients. And so it really leads to the message of trying to get things back to a new normal if we can, trying to get people back to the care that they need. And so if you have been, like Dr. Elliott pointed out, if you have been putting off care, Sanford does require masking of all employees, frequent hand hygiene. We've seen great rates of stewardship from that standpoint. We have not seen any hospital spread. In fact, as we look nationally on study, that appears to be a very low rate. In fact, healthcare workers, if they do get it, it does tend to be a community spread, but we have to be vigilant about that on a daily basis. We are here for your care needs. We feel we have a safe system that can address that. We have seen a decrease, as it has been shown nationally, in care of cardiovascular conditions like stroke and heart attack. We've seen a decreased number of screenings. We've seen a decreased number of immunizations. We have seen those rates come back, but not to a rate where they probably should be. And so really encouraging people, if you are having any symptoms, don't be afraid to call 911. If you're home ill with any upper respiratory symptoms, contact your primary care provider. Do not go out in public if you're feeling ill, and just be responsible from that standpoint. As schools open up, we've been working very closely with a lot of school systems across the state in regard to how best to mitigate any spread within a school. As noted, there probably will be cases in schools, and really taking that next step as to what you're going to do about that. And so have been working with a lot of school systems from that standpoint. In conclusion, I want to be respectful of everyone's time here, but a couple of things. As an organization at Sanford, we're very committed to our workforce. We're very committed to the economic advance of this area. And in that light, we have kept our workforce together. In fact, supported them as they supported us and this community in these incredibly trying times. And so we have kept our workforce together. We have increased their reimbursement because we felt that dedicated to our staff and felt that they deserved a reward for their efforts in this very trying time. The last thing I'll end with is really that importance, as Dr. Elliott pointed out, in regard to the influenza vaccination. As it is coming upon that season, we've seen the rates in the last several years go up from that standpoint, looking at influenza vaccination, and we'd really like good success this year. That is something that, while it's not a 100% effective vaccination, it is somewhat effective in eliminating the risk that you would get influenza. And if we could get that out of the equation as COVID is in our community, that would really be helpful to all of us, including us as healthcare providers. And so if the choice, or if it fits within your schedule, which it should, there'll be plenty of options out there. I'd really ask you, as soon as it's available, to get out there and get a flu shot as clinically appropriate. Beyond that, I'll just turn it back over to any questions that we have. Dr. Elliott, myself, the mayor are available. And thank you, everyone.
All right, thank you, guys. Any questions for myself or Drs. Wilde or Elliott?
Curious as to the home monitoring, what impact has that had on the hospitalization rates?
I'll reiterate the question. So the question is the home monitoring and the impact on, what does it entail and the impact on hospitalization rates? Unfortunately, I can't quote you a statistic. I can give you how I feel. Generally, the home monitoring program is really if a clinician feels that someone could be at risk for a hospitalization from COVID. So they may have some comorbidities like, obesity, lung disease, things like that. And they're monitored at home by a daily check-in, in addition to their oxygen saturation monitoring, temperature, blood pressure, and things like that, respiratory rate. Impact on hospitalization. I would say it certainly has decreased the need for hospitalization. Is it 10, 20%? I would merely be speculating on that, but I do feel it has had an impact.
Is it too early to get a flu shot? I mean, clocks will wear off before the flu season's over.
Yep. So the question is it too early to get a flu shot? It is right now because there's no supply, but that's changing right as we speak. Typically, right around Labor Day, it does come in, and certainly in my career, at least, I've seen that thinking really evolve to get a flu shot as soon as you think about it when it's convenient. We don't see that it necessarily wanes your immune response to that, so the sooner the better.
All three of you have mentioned possibilities of the likelihood of increases in cases when school starts. And I'm curious from a healthcare perspective, how is that going to impact your employees or kids at school? Because right now you have a workforce, but it seems to be another possible challenge.
Yep, absolutely. We are concerned about it. If our younger employees that have kids in school, if dual working parents, then when kids are home, that means somebody's got to be watching them. And with folks over the age of 60 being at higher risk for complications, I'm not so sure that it's a good idea to have grandma and grandpa being the de facto babysitters for our kids home from school. So as parents have to stay home from school, we will have to look at how we might adjust our staffing models to make sure we can take care of patients in the hospitals and clinic.
I'll add to that too. So the question was in regard to hospital or clinic staffing or healthcare staffing in regard to school outbreak, parents needing to care for students. And so we've worked very hard at Sanford, like I had alluded to earlier, really supporting our employees, including sick leave and things like that for those needs that would arise, and really making sure we have a good plan from a human resources standpoint in regard to caring for a loved one who might be ill. Dr. Elliott makes a great point, and that is, I guess, myself as a parent, the mayor as a parent, anyone, be thinking about what you would do in those scenarios. If someone were to get ill, yes, your employer certainly has policies in place to assist you, but what are you going to do? Who are you going to call? What are you going to be able to do? Are you going to be able to take that time off, or aren't you? And that's really a great point to be thinking about that right now, because that could occur in the future. Hopefully not.
Does anyone have any question for me? I got to actually get to another event, so if there.
When you talk about the possibility of a mask mandate sometime in the future, can you talk about what would precede that, what the data you're looking at would look like when you would begin thinking about that?
Well, we would rely heavily on, what our healthcare partners would have to say on that. So the hospitalization number is a big one. So, one number that we're watching, quite honestly, is that 40 hospitalization threshold, and that's per system. So if they'd have 40 and they'd have 40, all right, that kind of enters us into another tier of response. Right now, we've been right around 40 collectively as two systems. So that's a number that we're watching. We've gotten close to that a couple times, but it's not sustained. So the hospitalization number continues to be the one that would drive that. And moving back to business restrictions or gathering restrictions or anything like that, I'll just say it's hard for me to envision a scenario where we'd go back there again. We haven't done a mask mandate. That would be the next card that we would play, and that'd be a number that we'd watch.
making sure you have the right information and not seeing misinformation. Is there any misinformation you're seeing specifically that people are bringing up that you wanted to address or anything like that?
You know, what I will say is I love local media, and I'm not just saying this because you guys report what's happening in our market, okay? What's happening here. You're not reporting what's happening in Miami or in Charlotte. And too often I think that's where national news, we get local people that see that and they assume we're 2 or 3 or 5 cases away from being there. And we're just not. And so one of the things that, you know, continues to be a little bit of a misperception in my opinion is that a vaccination is very close and that will be the holy grail and COVID will be over. And one, vaccinations are never a slam dunk. And two, I think there's a lot of people who, when one does come out, there'll be skepticism over the validity of that vaccine. And do I want to be one of the first families to be, you know, using this new vaccine? And so there's just patience that people have to have and flexibility. So when I say the infodemic, look at local sources. Look at these guys. Look at our local media. Look at our public health team. That's where you're going to get the accurate information on what's happening in Sioux Falls, South Dakota.
And I talked about the hospitalization rates and the percent positive, but the percent positive is looked at by a lot of healthcare experts as how well are we controlling the transmission. Everyone has said this morning, controlling the transmission, reducing it is critical. How would not a mask mandate help that? And why is it 13% or 12% a real cause for concern now? How much higher would that percentage get?
Well, it's not a concern for me right now because our hospitalization rate's trending the opposite direction. So the more people who get COVID, just to be blunt, the closer we move towards herd. And the more people who get it without getting the severe effects of needing hospitalization, the closer we get to less spread in our community because more people will have had it. So it's the reason the CDC watches that and so many others watch that is because there's an assumption, and it's obviously very accurate, that hospitalization rates and positivity rates would be on a corollary path. We haven't seen that here yet. So that's why I'm fairly comfortable with that uptick we've seen in positivity rates because we haven't seen the same uptick in hospitalization rates. If they start to follow each other, then it's going to be different here. And that's why our market is different than another market. They may be seeing that exact correlation happening. We're not seeing that here.
One last question for you, Mayor. The One Sioux Falls Fund, is that all been exhausted or is the city still helping out residents with rent or businesses or anything like that? Because there's still a lot of folks struggling to meet things right now.
No, there is still funds in the One Sioux Falls Fund. There's still contributions that folks are making to the One Sioux Falls Fund, which helps with primarily home assistance, mortgages, as well as rental payments. So we would encourage people to still reach out to the 211 Helpline Center if they're struggling with making their payment to stay in their home. That's a primary goal we've had all along too, is make sure people stay in their homes. Because once you're out of your home, a whole nother bevy of problems starts to unearth themselves. So that fund is still available, and people can certainly reach out if they have a need for it. All right. If you have any other questions for the doctors. All right. Seeing none, we'll call it. Thanks, everybody.